Good afternoon. I'm Tammy Epps, and I'm the manager of media relations and social media for Prisma Health. And we are proud to be here today with a group of our experts to help you navigate all that's happening with COVID-19. We know that, there's a lot going on, and we know that you have questions, but that's why we're here with our experts. We also want you to know that the COVID-19 vaccine is available for any adult who is interested in receiving it, and that the Pfizer vaccine is now available to anyone over 12. We've all been so excited about that announcement this week. When receiving the vaccine is the most important step in preventing the spread of COVID-19, including the new COVID-19 variants. It's important that we all have the correct information so that we make an informed decision about the vaccine. We're learning new things every day, and our experts are on top of making sure we get that new information out to our community. Today, we want to take some time to share some of the information about COVID-19 with you and your family. And so I have the pleasure to introduce to you our great panelists. So we have Dr. Anna Catherine Birch. She is a pediatric infectious disease physician. And as you know, I know you have questions about the 12 to 15, so she's here to answer them for you. We also have Dr. Casey Eichelberger, who's an OBGYN, and she has been doing a great job of answering lots of questions about fertility. We have Dr. Jackie Jones, who's family medicine and who's seeing lots of patients every day and navigating them through this pandemic. And Dr. Freddie Revilla, who is a neurologist. And he also has been doing a great job and has been doing a lot of things with our Latino Hispanic families because he's a Spanish speaking physician. And we thank him so much for that. And we also have Dr. Saria Sacoccio, who you've seen on TV with us a lot of times. And Dr. Sacoccio has been helping us all. So that is our panelists. I'd like to also review kind of how we're going to work this. So we will be answering a few popular questions that we've been getting along the way. And also, if you have a question that you'd like for our experts to answer, please put it in the chat on our Facebook page, and then we will have one of our team members get those questions over to the analyst, to our specialists, and we'll try to answer them. We know we won't be able to answer them all, but we'll do our best. Thank you for joining us today. We are so excited that you're here with us. And so with that, with all the recent changes, we're going to start with Dr. Birch because we know that you all will want to hear from her first. So give me 1 second and we will go with Dr. Birch.
Hey, everybody. I'm so glad that y'all are tuning in to listen to us today. Can you hear me now? Okay, so I'm so glad that you are with us today, that we are able to give you good information about vaccines and COVID. We are so excited that the Pfizer vaccine just recently received an indication for children 12 to 15 years and above. And that is an amazing information, especially for those of us who are really trying to work on getting that herd immunity number increased. It has gone through various testing, and it was found to be almost 100% effective in preventing COVID disease in this age group, 12 to 15. It actually ended up being a better response to the vaccine than previously thought for the 16 and above. And so are there any specific questions that you would like for me to answer?
Dr. Birch, so How does the vaccine affect these children? And is it safe for kids to receive the vaccine? Why is it important for them to be vaccinated?
Okay, so number one, it is safe for them to receive this vaccine. There have been plenty of data to come out to say that it is efficacious, meaning that it absolutely works, and that the safety side effect, safety profile is good, and that it does not cause problems in pediatric patients of the 12 and older. So that being said, it is so important for this age group to receive their vaccine. I had mentioned earlier about the herd immunity. And essentially what that is the number of people in a population that need to be vaccinated to be able to protect others in the population who are not able to get that vaccine. This age group of 12 to 15 is a big part of that herd immunity. Those particular age children absolutely spread the virus just like an adult would. And so being able to have those children vaccinated would help us have more people vaccinated in the general population and decrease the spread of the virus to others who are not able to get the vaccine.
Dr. Birch, why hasn't the vaccine been approved for kids younger than 12?
So those studies are still ongoing. So that's pretty traditional how studies go is first, a lot of times they're done in adults, and then they move down age groups closer to the adult age. And so hopefully we will have that information to come out somewhere around August or September is when Pfizer thinks that they will have the completion of those studies performed, and that data hopefully will be able to be submitted both to the FDA and then the ACIP, which is the governing body for vaccines that's run by the CDC. Once that occurs, then we will be able to really work on the herd immunity and get as many people as possible vaccinated so we can all be safe from this particular virus.
If there's parents out there who are really concerned, what would be your message to them about their children getting the vaccine?
I think that this is the most important way to protect your child against COVID-19. It is very much in your favor and their favor to have your children vaccinated. It is safe, and it is definitely something that you should consider.
Thank you. With that, we'll go over to Dr. Eichelberger. Dr. Eichelberger,
Yes,
for adults, particularly adult women, one of the concerns about the vaccine has been whether or not it affects fertility. We have heard this week that there is new data to support that the vaccine does not affect fertility and actually can help protect an infant. Can you share more about this information?
Sure. Tammy, I love working with you. This is fun to have you on the other side. So yes, it's good to be back with everyone. For those of you who were participated in these before, we've had lots of conversations over the past several months with a burgeoning body of evidence now. So I come to you today with new data that have been published since March. So we've had a series now of 4 publications published in the Lancet, in the New England Journal, in JAMA, speaking to the issue of the impact of vaccination, COVID vaccination on pregnant women and on immunizing their newborns vis-a-vis what we call passive immunization strategy. So what does that mean? So researchers at several different universities in the US and abroad have looked at either the Pfizer or Moderna vaccine, so the mRNA vaccines, and they've compared women who have had vaccination at any given point during the pregnancy with their babies, so considering them as a unit, and have measured the amount of antibody response that the mom and the baby might have. What they found is that moms who get vaccinated more than 3 weeks before their delivery have significantly higher antibody levels in their own bloodstream, but also in the bloodstream of their baby, so as measured in the umbilical cord. What that means is it works a lot like our vaccine against pertussis or whooping cough. We can vaccinate a mom and actually passively get that antibody across a placenta if the antibody is the older type, the smaller type, get it across a placenta and help load a baby up. One group of researchers also took the placentas of moms who'd been vaccinated after they gave birth to their baby and compared those placentas to the placentas of moms who had not been vaccinated. And there were microscopically no differences noted to a group of pathologists who were blinded to which category the women were in. They could not tell any difference in terms of an insult at the level of the placenta. That's all very encouraging, what we call translational research that suggests that vaccinating moms not only protects that mama, but also protects the baby and indicates that it's better to get vaccinated earlier in pregnancy so that we can load that sweet baby up with all those good antibodies, just like we do to pertussis. So that's fantastic. In terms of actual fertility rates, we are still early enough in the pandemic. I mean, if we look at the timeline, only a year and 2 months ago were we actually starting to have conversations about COVID here in South Carolina. So because fertility is usually a 9 to 12 month cycle, we are still early in the space of collecting rigorous data, but the American Society for Reproductive Medicine continues to say that even if you're going through an IVF cycle, you may get that COVID vaccine. In fact, you're encouraged to, even in the middle of that IVF cycle. So there is no biologic plausibility to a reason why you should delay. So that's been very compelling news, essentially saying if you'd be willing to get a flu vaccine, you should be willing to get the COVID vaccine. I hope that's helpful, Tammy.
I was going to say, I know that you've been having a lot of conversations with your patients about this, and what has been the main theme of those conversations, and what have you told them?
Sure. So I think folks who are pregnant fall in the same groups as folks who are not pregnant. There are folks who are vaccine excited who say, tell me where I get in line and who do I need to push out of the way to get up to the front of the line. And we're excited to help that group. There's a group in the middle that I call the watchful waiters who say, have you had other people? How many? How many? And once the number gets to a certain place, they're like, okay, now I'll take it. And then there are the folks who are nervous, and they're nervous because new things make us nervous. But every year we get a new flu vaccine, and I encourage them to remember that every single year it's a new vaccine that we don't have perfect data on, and we all stick out our arms and say, okay, yep, let's do it. It's for the good of the crew, just like Dr. Birch talked about that good herd immunity. So now that the data are coming out about the protection of the babies, we're seeing women be more excited about the uptake. Things that they were nervous for themselves, they're saying, okay, if it's going to help my baby, I'm willing to consider taking it. So yeah, that's where we are.
Well, thank you. We're going to go to Dr. Sacoccio.
Hello, everyone. Good afternoon.
Hey.
It's great to be here with you today. And wow, do we have quite a cast of superstars today. I am honored and privileged to be a part of this panel today. Thank you, Tammy and Sarah, for coordinating our work.
Well, good. Thank you, Dr. Sacoccio. You have the question that everybody wants to know about. So this morning on the national news, everybody's taking off their masks. They're sitting close together. Somebody actually was sitting on somebody's lap. I don't think the guidance says to do that. But anyway, it was two ladies. They were being silly. But anyway, we learned that the CDC now says fully vaccinated people don't have to wear a mask indoors. Why is that? How does the vaccine work to protect them without a mask?
So thank you, Tammy, for that question, and one that I was absolutely curious to learn more about. So I've been doing my own reading this morning, and I saw Dr. Rochelle Walensky, the director of Centers for Disease Control and Prevention, speak to it today on Good Morning America. And I feel very confident with the recommendations that are coming forward from the CDC. And there are a couple of reasons that Dr. Walensky pointed out that made a whole lot of sense to me. So first of all, the clinical trials that were performed during the phase 1, 2, 3 trials for these vaccines have proven in real life and reality now to be consistent with those results. Where we had heard originally for Pfizer Moderna vaccines that the efficacy rate was about 95%, we are seeing very similar numbers. In fact, 90 to 95% effective for both Moderna and the Pfizer, and this is very exciting. Sometimes we see exceptionally positive or favorable numbers in a clinical trial because it's extremely controlled. You have individuals who are participating because they're interested in advancing science, and sometimes that can favorably improve those results. Well, just like we heard from Dr. Walensky today, they have been proven to be true in millions upon millions of individuals who have received these vaccines now. So that's really exciting news. It is proving to be true. We have also learned a whole lot more about the variants that are out there. And we've seen some excellent results even against the variant virus that has been out there and circulating across the US. And you may have follow-up questions about that in just a moment, so I won't get too deep into those details. But this is all good news. And for these reasons, I understand why the CDC is putting these recommendations forward. Now, there are probably a couple of questions that you have. In fact, I was interested to read that though masking for vaccinated individuals in indoor places has now been liberated or relaxed, there are some places that it is still very, very important to wear your masks. So we have understood from federal regulations, tribal regulations, we need to continue to follow those rules. And in areas such as planes, trains, public transportation, and hospitals and doctors' offices, it's very important that we continue to mask in these spaces. Why, you may ask? And it's because with these groups of unvaccinated and vaccinated individuals in these public spaces, there is a greater risk of exposure because we have vulnerable patients and populations who may be sharing these environments. So the good news is for those who are vaccinated, it is indeed safe, and the CDC is coming forward with these recommendations based on the science and the data that's available to us now. So again, very excited about these results, and I think it gives us a wave of relief and an opportunity to breathe, literally breathe without a mask on, indoors, outdoors, for those who are vaccinated. And my hope and our hope in the community is that this will also help encourage others to step forward to get those vaccinations so that you no longer have to wear a mask in these indoor spaces.
Dr. Scoggio, we know that there's still a large population that are unvaccinated. So a lot of people may be choosing to continue to wear their mask in areas where they're unsure. What would you say to those people?
Tammy, I would say do what you feel comfortable doing. If you are vaccinated and you feel more comfortable in a mask, wear that mask. We have some questions lately about parents who have children who are unable to be vaccinated or haven't been vaccinated yet. So in those cases, you may be wanting to set the example for your child. What is important is with that we respect the wishes and the behaviors of all of those in our communities. So we should avoid shaming of not wearing masks. We should avoid shaming of people who do wear masks. Remember, this is a choice, and we are all getting comfortable with these changes in our environment and the recommendations coming forward based on the science that's now available.
Those who have had COVID already have some protection, Dr. Scoggio. So what would you say to those people about getting the vaccine?
This is a common question. As we know, we've had a significant number of individuals who have had COVID in the past. In fact, I'll share a story. Just yesterday, I received a question. There was an individual who had COVID about a month or 2 months ago, had recently been exposed to COVID and had a cancer diagnosis. For all of these reasons, we have individuals who are still vulnerable. And so my recommendation is go get that vaccine. We are beginning to see people who have had COVID 3 to 6 months ago, and interesting and anecdotal stories of them giving plasma, donating plasma or blood where your antibodies have been checked. And here's what we're seeing. Antibodies are beginning to wane. So though there may have been some protection, we don't know how much protection, there is a wave now in a spectrum of those individuals who are no longer indicating protection against COVID, evidenced by a reduction or complete elimination in some cases of an undetected antibodies now against the virus. So for these reasons, it's so very important for everyone, even those who've been exposed to COVID, who've had COVID, to go get that vaccine and protect yourself. And it allows you to no longer wear a mask.
We had a question from our Facebook community. The question is about if they're visiting elderly parents, is it safe to visit them now without a mask when all the parties have been vaccinated?
Yes, in fact, all evidence is pointing to there is an opportunity now to hug those necks of your loved ones, your grandparents, your mothers, your fathers, those that you support. Please, if they are vaccinated and you are vaccinated, please know that it is safe to once again be without masks, getting back to this new normal. And in fact, in many ways, the normal that we understood before COVID. So yes, enjoy your family members, your friends, your loved ones. This is an exciting time to celebrate and rejoice the science that has brought us to where we are today in this pandemic.
Thank you, Dr. Scotia. We'll go to Dr. Ravilla.
Thank you, Tammy, for inviting me again. And thank you to my colleagues for being in the front lines, taking care of patients as well. In my role as a neurologist, I get to see the neurological complications of COVID-19, of this new virus in this pandemic, but more importantly, get to see as well some of the long-term complications. And at this point, would you like me to expand a little bit more on the long-term effects of COVID-19?
Yes, sir. Do you know any more about the long-term effects of COVID, how it affects other systems of the body, such as the nervous system or cardiovascular system?
Absolutely. So we now know for a fact that some patients survive through the acute phase of the illness, and the majority of them recover. Of course, there's some that don't and have major complications of the illness. And there are actually a large number of patients who have lingering symptoms, and we call that the post-COVID syndrome, and it can affect different organs in the body, including the lungs, the heart, and the brain, which again, my specialty is the brain, and I get to see those patients. So just to tell our audience what those symptoms can be, fatigue, being tired is one of them, very prevalent, very bothersome, difficult to get rid of. Shortness of breath or difficulty breathing. Some patients have cough, joint pain, chest pains. In my area of expertise, we see patients with memory problems, with concentration difficulty, difficulty sleeping, muscle pains, headaches. Some patients still complain of the loss of the sense of smell or taste for several weeks or months after having the infection. Very important, depression or anxiety. Some patients develop a form of PTSD if they have been in the hospital or the ICU. PTSD is a post-traumatic stress syndrome from having experienced this ordeal with the disease. A lot of patients experience dizziness after standing up, or some of them even without standing up. All of these symptoms can get worse when the patients do physical or mental activities. And specifically on the neurology field, on the acute illness, we can see strokes, seizures, blood clots, syndrome called Guillain-Barré, where the peripheral nerves get affected and the patient develops weakness. And we even have seen in younger patients post-COVID syndrome of difficulty walking with involuntary movements and involuntary movements of the eyes that lasted for several weeks to a few months, and even wrote a case report on this. So I think there is extensive documentation now in the literature, not only for the severe symptoms of COVID-19 in the acute phase, but also for weeks or months after the infection. Again, making the best argument to get vaccinated. And so glad to hear my colleagues and the experts recommending to get closer to our normal life pre-COVID. And the only reason I think we are where we are today is because a lot of us have been vaccinated.
Dr. Ravilla, I know that you have been working really hard to try to get that message out to everyone who is interested in getting their vaccine. If you were going to give a message to, I know you worked a lot with Latino and Hispanic families, what would you say to those families also about the importance of getting the vaccine?
Absolutely. I have participated in some discussion forums with the Hispanic community as well and heard some of the questions. If I had to summarize, it's the fear of the unknown. And there's also some misinformation coming along that we need to clarify. So the recommendation has been 100% to get vaccinated as soon as possible, because the consequences of having the acute illness are definitely much worse than not being vaccinated. And that has been the message. And the positive report that I can give to the group is that when people are explained these things, people understand very well and then have a much more positive attitude towards being vaccinated. The other point that I have discussed with my Hispanic community, and not only at the local level, but even at the national level, is that we are privileged to live in this country where some of our relatives or friends who are in other countries, in particular in South America, don't have access to such great vaccines. This has been a major success in terms of the scientific development of the vaccine, and we have access to it, and we're very lucky to be here able to get the vaccine.
Good, thank you. With that, we'll go to Dr. Jones. Dr. Jones, I know that Dr. Ravilla was talking a lot about long-term effects of the vaccine. I know in your practice, you're seeing quite a few patients who you're having to take care of who are having some long-term effects. Can you talk to us about that?
Hi, Tammy. Sorry, I think I was on mute before. So, you know, the long-term effects of COVID, I think, are ever evolving and are interesting to me, probably not for the people coming in, but, you know, I've kind of been saying this for a long time. So, you know, my concern, probably since we first started doing these, was always like, what about all these people in between? So we've been seeing them for a long time. We've not necessarily defined it, you know, as post-COVID syndrome, but we, you know, as outpatient clinicians, we've been seeing lots of people that are always still short of breath. Hair loss is a big one that has come up. I get people that are very concerned about, you know, their hair. And so, you know, that has been a big one. A loss of taste and smell, which seems to be waxing and waning. For people who do not know what that means, it means that 1 minute you taste and you smell everything fine and you think I'm out of the woods, and the next thing, bam, it's back, you know, with the force of nature. And so those are going, in addition to chronic cough and fatigue and those things, and the variety of those symptoms and the severity of those symptoms have been, you know, really unpredictable. And so it is significant. It's life altering. I'm a family medicine physician. So when you're in my office, I'm always thinking of your disease process, how we can fix them right now, but also how it interacts with how you move about the spaces that you exist in. And the chronic conditions of COVID are disruptive. They're very disruptive. They affect jobs. They affect dynamics between family members. You know, if someone does not like eating, then they're not going to want to sit down for dinner. So I have people that are having problems with weight loss because nothing tastes the same. Sweet things taste like fish or garbage, although I've never eaten garbage, so I'm not really sure what it tastes like, but I believe them when they tell me. But it's problematic. And so the difficulty is educating patients that there is no one thing that is going to cure all these things, right? I cannot get you back to baseline. I can have empathy and some sympathy, but we're just here, you know, treating things that we know how to treat, right? We understand how things should work. We understand what goes wrong when they don't work, and maybe add those two together, we might get to a treatment that works for you. But as many have said, you know, we're learning every day, and we do not have cure rates for chronic diseases, chronic COVID symptoms. And so it is challenging in the clinic.
There has been a lot of conversation about what I guess side effects is not the right word, temporary side effects people get when they get their vaccine. So talk to us about that, because people are saying, they're worried about getting their vaccine, but they but my arm might be a little sore. So
Right.
Talk about those.
I got you. So I've been telling people, instead of calling it side effects of the vaccine, I prefer we said an immune response, right? So what you are having is a healthy immune response. As people who have no immunity, how they would like to maybe have a fever, have some chills, something like that. So when people are getting their vaccine, some people are saying, oh, I had some soreness at my arm site where they injected me, or under my arm really hurts, or right under my neck where it happened. And most of those are symptoms that your body is reacting to the thing that we gave it. And we want it to react, right? We want to wake up the immune system to say, hey, you gigantic sniff dog, the next time you see this in the system, I want you to attack, right? And in order for it to do it, it has to learn it. So the whole body does what it's supposed to do. It turns on, it sends all its protective cells to learn about, spike proteins and everything that we've given it to say, okay, the next time I see this, I will act early and often. That does sometimes result in arm pain and underarm pain and, a little bit of fatigue and some arm soreness. But most patients say, oh, I felt like that for a day or two, and then I was fine a little bit later. So I'm trying to convince people to not be afraid of you having a healthy body that does what you want it to do. I know that nobody is signing up to have a sore arm for a couple of days, but it's 2 days, maybe 3. It goes away. For some people who have really, really bad soreness, a heat pack or a Tylenol, if you have to have it, tends to make it go away. But they're not side effects. They are a healthy immune response.
I love that, Dr. Jones. Thank you. A lot of people have asked about whether they should get the vaccine if they have allergies or medical conditions. What do you tell them?
So I tell them, okay, so then we've got to define allergies, right? So, if you've ever worked in an outpatient setting, then we've heard many stories about allergies. All allergies are not created equal. And some of them, from a physician standpoint, are more significant or severe than others. So if you carry an EpiPen because a doctor told you that when you come into contact with something, you have such a severe response that you may stop breathing, your tongue may swell, something may happen that you need an EpiPen to carry around, then you have to have a conversation with your primary care doctor or your immune specialist or your allergy specialist to say, how do we go about getting this vaccine for me? So the answers often are never completely no, but how do we do it in a way that's safe for you? Allergies, the everyday allergies, we're welcome to South Carolina. I think we've all been sneezing for the past, month and a half with the influx of pollen and everything. Seasonal allergies should be fine, right? You're okay to get it with seasonal allergies. If you have an allergy to a medication, we want to know that so we can make a decision about how we go about getting you vaccinated. The people that I'm concerned about it, they say, I have had vaccines before and I've had a very serious reaction. You, that small group, are the people that we want to make sure we know how to go about getting your vaccine. But everybody else has got run-the-mill allergies. You're going to be safe. Just let us know. We will walk you through the process, but you too can still have your vaccine.
How does the vaccine create an immune response if it doesn't have the virus in it?
So I am sure that some immune specialists could give you this, but I'm gonna give you the quick and dirty way that I talk about it in my clinic room. So when we are giving you the vaccine, Pfizer and Moderna, all of them are really after one thing. If I show you the outside of it, will you attack whatever it is? And the answer to that in most immune systems are yes. So I kind of use the example of, like, think of your immune system as an alarm system. So we are showing your immune system a little tiny part of what's on a virus, right? And so we want to make sure the next time your immune system sees a little tiny part, it reacts. We do not have to give you the whole virus for it to do that. Most people, especially in this case, as we're learning the virus day to day, we would like to not inject people with actual live virus. So when the scientists got together and decided the safest way to do it, showing you the outside of it was the best way to make that happen. It's, the technology for this vaccine is relatively new, but it's It's been good, it's been successful, and it's been one way that we've used vaccines for a long time to give you access to protection without infecting you with the virus. So there is no virus in your Moderna or your Pfizer. So people do not have to worry about, are you going to have to get sick with the virus in order to get a response? People who are getting vaccines are having an immune response, not because you have the virus, but because we're giving you something that we want you to learn from.
All right, with that, I'm going to go to Dr. Birch. Maybe she can add something to that conversation. Dr. Birch?
Yeah, so you did a great job explaining that. I don't know how much more I can add other than, you know, it's the exact same argument or thing that I say to others who try to tell me that you get the flu shot and I get the flu from it every year. That's not the case either, because you're not actually having the vaccine from the entire viral particle. The actual piece that you make antibodies towards is what they call the spike protein. And that is the one of the parts of the protein, like was said before, that is on the outside of the virus. So as long as your body recognizes the outside of that virus, it can turn itself on so fast to make other antibodies to protect you so the virus can't enter your cells in your body. The other thing that I would like to say is that this new technology that we are talking about is the mRNA, messenger RNA virus encoded vaccine. And so what happens with that is it's really actually very ingenious. It's a small piece of messenger RNA that your body makes the protein to make antibodies against. I suspect in the future that this is probably how the flu vaccine also will be made in the future. It is a great way to make vaccines very quickly, but very safely as well.
We also, we had a question about variants and we didn't talk about that. So wanted to ask you that while we're on here. How about the COVID-19 variants that we heard about? Are they still a factor and something to be concerned about?
So sure, we always are concerned about variants. And what we mean by variants is basically the original COVID-19 virus had one genetic makeup, and viruses are very smart, right? They try to change themselves genetically so they can get around a human's immune response, meaning it makes it harder for humans to make antibodies against the virus. It's a cat and mouse game that viruses have that they play. And so these particular variants have changed their genetic material just a little bit to kind of change what that spike protein looks like. That being said, with the particular vaccines that are out there, specifically Pfizer and Moderna, the good news is that they do fairly well at still protecting you against these variants of the virus. We're obviously getting more data as time goes on, and there might be some time where scientists decide to change the vaccine just a little bit. We're not there yet, because what we are seeing that even though there are variants, the vaccine itself is creating enough protection in you and I to keep us from not getting infected with the COVID-19. I just would like to speak about the variants that are in South Carolina. Currently, there are 3 variants that we're seeing in South Carolina. The first one is the UK B117 variant, and that is the one that's the most prominent in South Carolina. And then the second one is that South African. And then lastly is the new P1 Brazil variant. That being said, when you compare the number of variant infections to the number of the original COVID-19 infection, those numbers are so small. Typically, you know, our major circulating strain of the virus is still that original COVID-19 virus. So another plug-in, please go ahead and get your vaccine if you are eligible to get it, because this is the best way to protect yourself from the original COVID-19 virus. And in addition to that, the variants that are circulating around.
Good. With that, we'll go back to Dr. Sacoccio, please. Dr. Sacoccio, we had a question from the audience about testing. Previously, the recommendation was to get tested before seeing family, traveling, etc. How does that change now if you are vaccinated?
According to the CDC guidelines, now listen closely, because this is where it can get a little complicated. According to the CDC, once you have received your full vaccination series, and so that means 2 weeks post your final vaccine. So if you're in a 2-dose series, that's 2 weeks past the second dose, or if it's the Johnson & Johnson, it's 2 weeks past the 1 dose. For 90 days, if you have exposure to COVID and remain asymptomatic, you do not need to test. And what we also hear from the CDC is there is no longer a need to test if you have been immunized and are asymptomatic. Now let's talk about what happens if you have symptoms that are similar to the COVID virus. If you have a sore throat, if you have a fever, if you lose your sense of taste or smell, you must be tested. Even though you have received the vaccine, we have recognized, though these cases are not common, you can experience a breakthrough case of the coronavirus. So be sure that if you're having symptoms, even if you're vaccinated, you continue to be tested.
Good. Thank you, Dr. Sacoccio. We appreciate that. With that, we're going to go back to Dr. Jones.
Okay. Am I?
Oh, okay, there she is. Hey, Dr. Jones.
Okay.
So I know that, you know, people who are having concerns about the vaccine, I know that you said in your conversation with them, you have been talking to them about the fact that even if they have some concerns, that doesn't mean they don't get the vaccine. So can you talk to them about that?
So, you know, I think that one of the things I want people to understand is that there is room for concern and skepticism and questions while still making a decision about protecting yourself from COVID. So I think what we're trying to get people out of the habit of, especially underserved populations, that if I'm concerned, I'm suspicious about it, then that must mean that the Lord is telling me no, right? That is not what that means. It means that you need more information. It means that you have questions that you want answered. You know, I think, you know, everybody, you know, all the physicians that are, you know, on this panel had questions about the COVID vaccine when it first came out, right? So, you know, we were allowed to do some of that legwork maybe before you got into my office, but having questions or concerns about, you know, what this vaccine is, you know, how did we get it on the market so quickly, are fair questions that we're more than happy to answer. But we can answer those and still get you to a point where you say, thank you, I've got enough information, it makes me feel better, I want to protect myself and my family, I'm going to proceed and get my vaccine. So we just don't want people to stop, you know, before they go through their process, right? So that's why I tell people in my office, like, fine, be a skeptic, ask all your questions. If it ends you getting the vaccine, great. So we can, you know, we can talk about hesitancy. We can talk about, well, can I get it next week or next month? Like, we've got lots of flexibility in there. I want you to be aware of your risk. I want you to be aware of the things you can do to protect yourself and the timing of those things. Where you choose to get your vaccine in that timing is going to be a personal decision, but you can make that choice and still get all your questions, ask your questions and get your questions answered.
Thank you. With that, I'll go back to Dr. Eigelberger. I know that there also have been some questions about women who are breastfeeding and whether it's safe for them to get their vaccine. And I'd love for Dr. Eigelberger to answer that one.
Sure, I am happy to jump on that. I just want to, before I do that though, I'm going to steal the spotlight for a second and just say, Dr. Jones, I just perpetually love hearing you talk. And no one wants to taste sweets like fish for the rest of their life. So I just want to repeat that for the end in case people are just pulling in, like, That does not sound good for South Carolina. Let me just put that out there. We've got a lot of lovely things to cherish, and you do not want sweet tea going in your body tasting like fish juice. So that's one. Second thing I want to say with regard to what you're talking about is it is a fascinating experience to be a physician, to have spent a lot of time training and to try to lead people to healthy outcomes. I have a beloved family member for whom, if they go to the doctor with cold symptoms and don't get antibiotics, they come back aggrieved, right? Like there is a real belief that they know better, that they need antibiotics. And so there is a funny time right now where a lot of us practitioners are antibiotic conservative, and people want more of them and feel like we're not doing enough. But when in turn we move to a preventive medicine approach and say, but you really should get the vaccine, they're like, no, I don't want that, but I'll take your vaccine, or I'll take your antibiotics. And it's a funny time to practice. So anyway, just wanted to lift that up. Yes, Tammy, breastfeeding. The Academy of Breastfeeding Medicine has been a phenomenal research, and thankfully, women who are breastfeeding have been donating milk after getting the vaccine for measurement. Of course, there is not virus in the breast milk after they get the vaccine, because again, as Dr. Jones and Dr. Scocho said, you're not getting the virus, right? You're just getting a little snippet of mRNA that encodes for a protein. So there is no virus, there is no COVID in your breast milk, but what there is in measurable quantities are antibodies that are anti-COVID. So the good things, what protects you from COVID. Now, how much that oral ingestion of those antibodies, how much that will do to protect a baby versus the ones I talked about from in utero that go into their bloodstream, yet to be determined. So we don't have enough data to support the fact that breastfeeding, receiving breast milk, human milk from a mama who is lactating and has been vaccinated is protective for the baby. We can't say that for sure, but what we can say is they are getting a little bit of that antibody. The Academy of Breastfeeding Medicine says if you get your shot that day, you can continue to breastfeed that afternoon. There is no window where you need to pump and dump. You may continue to feed throughout that period of time. We certainly support at least 6 months of exclusive breastfeeding for all mamas, including those who have been recently vaccinated. So full steam ahead, and South Carolinians, we encourage you to breastfeed.
Good. And because you were talking, I guess now they're like, oh, let me ask her another question.
Oh.
Do we know if there are plans to do clinical trials that include the effects of the vaccine in in women of childbearing age?
Oh, absolutely. Sure. So I don't know how many of you signed up for the CDC's follow-up processing after receiving your vaccine. It's called VAMS, and VAMS continues to send me weekly updates checking in to see if I'm pregnant, which is certainly they're not naturally concerned about my reproductive history, but they are concerned about tracking me if I become pregnant. They're interested in building a data set. Right now, there is a big national NIH study collecting all sorts of data on women around the time of pregnancy who've been vaccinated or had COVID, and we are part of that here at Prisma Health. So yes, and yes, and yes, lots of data to come.
And I think you said earlier, Dr. Eichelberger, that none of the studies that have already been done have had any negative impact related to women and the vaccine.
There is not a single study of which I'm aware that has undergone peer review and has had any deleterious effects on reproductive age women around their fertility. That is correct. I'm not avoiding it at all. I'm just being very specific so people in the back pew hear us. Not a study that has undergone peer review. What hasn't undergone peer review is your high school buddy on Facebook. That's not a peer review study. But the process that we have to go through to get published, which is a labor of love, nothing has come out of that process where they said, yep, there is danger. And if there was a danger signal, we would all want to put that out, right? Like everybody wants to know truth, capital T truth, no more so than your doctors. We want to know. I want to make sure that when I counsel people, it is responsibly.
All right, I'm going to go back to all the doctors for a final thought. Your final thought on the vaccine, anything you wanted to say, Dr. Eichelberger?
Yeah, be brave, go get it, speak publicly about your experience. Nobody wants to taste like fish juice for the rest of their life. That is it.
Dr. Rivilla, I'm coming to you. Final thoughts?
Yeah, just to tell the audience, and in particular the Hispanic community that may be listening right now, to again, reiterate the point that it is perfectly fine and okay to have questions, and we are here to answer them. So please reach out. Once you learn the answer to the questions, you may decide to get the vaccine if you're hesitant. Thank you very much.
Dr. Sacogio.
Remember that we have access to this life-saving vaccine, and it remains your choice. It's our choice what we choose to do. Continue to be educated, get your questions answered, look for the science, refer to reliable sources, and let's be kind to one another and respect those choices of all.
Dr. Birch.
So I would say that please look at the information about getting your children vaccinated. It is so important to not only protect them from this particular virus, but to help protect all the population from this virus. We ask that you seriously look at getting your children vaccinated because in the end, it is what will help us achieve a high enough herd immunity to be able to protect all people from this virus.
Dr. Jones.
So I think that as we're coming into the summer and the CDC is releasing data about you don't have to wear masks, people are going to feel more free. And we know that this summer, people are going to move about the world. They've been waiting, right? So the summer is coming. And I think that what I want people to know is you've got to make a choice, right? In risk or protection, you're making a choice. So ask all the questions you need to ask, but really consider how you want to go about protecting yourself and your family for the summer and stay safe. We want people outdoors, right? We want you to exercise. We want you to enjoy family, and we want you to do it in a way that protects you and keeps everybody well. So stay healthy, stay well. Yes, get your vaccines. If you are concerned, come see us. We'll answer your questions, but still get your vaccines when you're done with those questions, okay?
Thank you so much. Thank you so much. I want to thank all of our experts. We're privileged here at Prisma Health to have some outstanding clinicians, and this team that we have right now are rock stars. So we're glad to have them. One other thing, I want to remind you that vaccines are available. We have them at all of our sites. You can walk in. Did you hear me say that out loud? Walk in. If you don't have an appointment, we will help you on site get an appointment. Yes, it might be a little easier if you go to my chart and set up an appointment, but we will make sure that you get a vaccine even if you show up there. Bring your children, bring everybody, just come on down. We're happy to have you. So if you have a question, you also can set up an appointment by phone at 1-833-2-PRISMA. 1-833-2-PRISMA, or our website is prismahealth.org/vaccine. So we're here to help Prisma Health and our wonderful team of experts. We thank you for listening. If you have additional questions, put them in the chat. We'll try to come up with an answer. Otherwise, be well and get your vaccine. Thank you so much. And with that, we'll be out. Have a great day. Have a great weekend.
Bye-bye. Thank you.